what causes a stroke? And I personally hate strokes because if it's a debilitating stroke, honestly, it's worse than dying because you're alive, they can't bury you, you're dependent, you're bedridden, your lifestyle, your quality of life is zero. We have to prevent a stroke. The most common cause of a stroke is atrial fibrillation and atrial flutter. It's an arrhythmia of the upper chamber of the heart. And so why do people end up with a stroke is because a lot of people do not feel the arrhythmia. They don't even feel that they're in a arrhythmia or have a heart rate of, let's say, 110, 120, 140. So they end up with a stroke, unfortunately, go to the hospital, and the electrocardiogram or the telemonitor shows atrial fibrillation at a rate of 120. You look at the patient, ask, how are you feeling? They don't even know that the heart rate is abnormal. If you check your heart rate at least once a day, just check your pulse. See if it's regular or irregular. Just once a day. And if you're in normal rhythm for that one time or 2 times a day, for example, the chances of you getting a stroke is almost zero. Why? Because you have to be in atrial fibrillation or atrial flutter for 48 hours contiguously in order for the blood to start to coagulate in the appendage. And once it starts to coagulate in the appendage, that's when, let's say, you convert into normal rhythm and starts to squeeze. And once it squeezes, that blood is embolized where? To the brain or to other parts of the body. But we care about the brain the most because, of course, if you have a stroke, you're debilitated.